I don't know if you saw the email, but I'm going to have a mask conversation today.
Yeah, I was just rereading it here, and so yeah, I was curious about that, especially the part about where you said that you know there can be some harm, or there's studies showing some harm in wearing the mask. And I don't know if that's, well, you'll talk about it, I guess, but I don't
Yeah.
know if that's in wearing it incorrectly or not cleaning it properly or what, but
All of the above, and just, it's more about sharing the information on what's kind of not really out there, and what to do about it. And then just kind of understanding where you go from there as you find out the information, and then do all those risk assessments. And then, but, since I was on site last week, I heard that someone did pass out of heat exhaustion. And so I was curious. I didn't follow up to, just kind of get a little more specifics. What was the current health of the person anyway? There's so much that goes into it. So it's hard to say um, where it might have come from. But I think
yeah,
it needs to be more of a candid discussion. And I think for safety pros who have to, they're in that middle of, well, this is what they're telling us that we have to do, but this is what I'm seeing, and this is real world how it's working. um I think it needs, just, you have to have the conversation, and not to, well, not to purposely stir the pot, but I know it will, um on lots of things, right? It's like, I don't want to
I
make
believe
it harder.
the safety group that I'm in for reclamation, that we had a regional call here just last Thursday. Am I saying last Thursday? Yesterday.
It's so hard to keep track.
I I can't believe. Yeah, boy, it was a busy day yesterday. But the call, there was a lot of discussion, and we've had it before about the fact that technically for like wearing an N95, that the person should have had a respiratory, a pulmonary exam and a respiratory clearance to go ahead and wear one. Uh, and I know, for some people, that breathing through one is going to be tough, and I know I see people out there that have like a 3-ply or more, that face mask that they created. And I'm thinking, that's got to be similar to what it would be like breathing through an N95. And there's some people, that it just would be too tough for them.
Right. And
So,
yeah, and that's where, just kind of from a physiology perspective, it's not necessarily a lack of oxygen, it's just stressed breathing. Um, that is more of the problem, that it's creating differences at other levels. So it's more about, you have something on your face, it's not the way it's supposed to be. You're tense, and that tension goes all the way down to like the capillary level, and then you don't get as good absorption, and then it's just snowballs from there, from the physiology perspective. But I know a lot of people are like, well, I'm not getting enough oxygen. That's not true. You'll always get enough oxygen. It's more about your carbon dioxide tolerance, which a lot of people aren't tolerant. And I think you were on that conversation of, you get more tolerant with your carbon dioxide, you can hold your breath longer underwater. um, so you
yeah.
can kind of work on those sorts of things, but otherwise, I think it's just this, for some people, the stress of wearing it, and then, you just feel it. And honestly, when I was walking around, um, unfamiliar territory, it's a trip hazard. I caught myself a couple of times, like, whoa, you can't see from here.
Oh, I see.
It wrecks your peripheral from here down. So
Yeah,
yeah, so you have it, and then you're like, well, wait a minute, there's a certain area that you can't see where you're stepping. Um, probably one of the more minimal risks, I would say. I think the heat exhaustion is one that's definite, and one for these, neck gaiters that are also around your neck, and that's where you're supposed
Mm-hmm.
to uh, expel your heat, right? Your femoral artery and your carotid artery are where you're supposed to regulate your temperature. So it just becomes a conversation. And then, my favorite are and I'm sure you especially, you see that people wearing the N95 and it's like over facial hair. And you're like, well,
Well, and that's what, they're supposed to be fit tested with an N95 too. Uh, we can't really do well, not very easily anyway, do a quantitative. It's got to be the qualitative, where it's, the bag over the head and banana oil or something else, to see how it works with them. We actually stopped using those years ago because we didn't think we could fit them, properly. And so we decided, no, we're just going to get rid of them and have all our people go ahead and use a half face or a full face, air purifying cartridge, respirators. And so when this came up and we sort of wanted to use some as more of a nuisance or something else, yeah, we had to scramble to try to go out and get some, because, we'd gotten rid of them all. About
right.
the only people I think that was somebody that was mowing the grass and was more of like an allergy type thing to help out.
Yeah, and then they're hard to find, and then it's all this. I have a question for you. I was just reviewing from my massage therapy certification and the licensure, and the guidance on for a massage therapist and doing it. They had a whole video through my ABMP certification, and it kind of goes through all the PPE to wear and how to don it and doff it and all these things. But then they went over an N95, and they kind of like, well, all you have to do is hold it and make sure that air comes in or out, and like a self fit test. And I'm like, I don't know if you can do that. Can you?
No.
You can't do that.
No. And that's the problem with N95s. We sort of like fit to a higher standard. And so we use a Veripro. Well, anyway, we use I want to say it, a fit test machine.
Okay.
That will go and measure, what's coming in through the normal air. So I'll end up having to burn candles or something, trying to get the particulate in the air up high enough to be able to measure effectively. And so we'll go ahead and we will, measure what the mask is really filtering out. And you can't believe the difference in results I get when I fit test somebody. And the smallest thing, a little bit of, material on, boy, I'm having one of these days. I'm starting to say a rubber material, but it's not. It's not vinyl either. It's
the lining, the place where it's attaching to your face, right?
Yeah, well, this seal, and I was trying to think of the actual material, and I'm just having a brain cramp. But at any rate, just I've had people, I can't fit test them, and I'll take it off, and I don't really see much, but I'll clean the surface, and just small amounts of dust or dirt or whatever, and then all of a sudden it fits better, and as it warms up the material, it starts to fit better to the face. And I'm thinking of how sensitive it is. If they've got a little bit of stubble, just a little bit, it can make all the difference in the world. And now you compare that to this N95 paper respirator, that the seal there is terrible. And so, yeah, there's just no way that it gives you as good as good protection as you would get with, more of a tight fitting respirator.
Right. And that's where, no one could really tell that on their own. They're like, oh, is air coming out or in? And they didn't even say why, but it was interesting in the rest of this video of guidance. They're like, well, we don't really recommend N95s anyway because they're not protecting your clients from getting it, essentially. And I was like, wow, why are we going through this whole thing on how to do it? I can go way down the rabbit hole into gloves. I don't want to do that exactly, but I think it's just a confusion of information. And I guess that's where kind of the candid part comes in the conversation, is that when there's inconsistent information and you're telling the world to do something and regulating, that's where frustration comes in, from especially the general public who has no idea. And then me, who I have a vague idea of, at least I've seen an N95, I've heard about fit testing. And then the safety pro who, you can see it from such a different level. That frustration, I think, is what's building at this point, to a point where I just want to have the conversation. Where does it go from here? Right? You see everybody protesting and they don't have any, some have masks, some don't, some are wearing it, in all different ways. But you can't have, a family funeral and all those sorts of things without the right things. My daughter has an 8th grade graduation, and it's Catholic school, so there's mass and then a party afterwards. So it's kind of like, well, if we're properly spaced. Anyway, I mean, that's where my brain goes. I'll admit it. I don't wear a mask to the grocery store. I don't, because I see how poorly the general public is wearing them. That is not making a difference in my tunnel vision of a view.
I got to admit, reading the email that you sent and talking about the course that you took, I'm assuming that was Arizona State?
Yeah.
ASU?
Yes.
Yeah, and so, that course you took about sort of, I guess I'm paraphrasing, but, delving into, studies that are done and everything. And I got to admit, I'm sort of the same way as far as a skeptic. I guess, I've always seen how facts can be twisted. And so anytime I see a study that comes out, I'm always a little bit like, well, asking some of the questions that you did, you look at it and you're like, well, was that really what you got out of it? Or, you said like the drinking a gallon of water or something. It seems like there's other things that they haven't really, in my opinion, eliminated as being what may be the reason why they got the results they did. Or there's so many other things, the sample study they took or whatever. I don't know. And maybe that's the reason why I'll see a study that comes out that says one thing, then you wait long enough and you'll see a study that comes out that's just the opposite. And they both seem to have facts to back it up. And, I just wish I knew more to sort of know which side of the fence to lean on.
Right.
But
I'm all about digging in. And there was actually some of the links that I kind of followed down through. I can send you if you're curious about them, but I'm all for reading and, doing that. If I hear something and I'm kind of skeptical, then I want to read more and do more. I'm not one to jump to conclusions, but I question everything because you have the studies that are like, ooh, it's this fabulous product that's making you lose weight. It's not the gallon of water you're drinking each day. But really it's just the water, but spend your money here. Those drive me crazy. But what was it in the last year or two that the study that way back that brought on the whole wave of fat-free everything, right? That said fat was the enemy. Not really. They doctored the study and it was sugar. So, how are we supposed to go with all of this? And then you just get into real world experience through that all. And sorry, I just got distracted because Kelly Campbell popped up her little picture. I haven't seen her in a long time, so thanks for putting your picture up there, Kelly. We haven't seen you in a bit. But anywho, are you gonna jump on for me? You can totally unmute. You guys, we're in a small little party here, so I don't care if you're unmuted.
I'm just muted because my phone was ringing and my dog was barking. So it would have been a little distracting, but the dog seems to have found a chew toy. So
yay, hi Kelly.
that's got to be tough after. It's not that we've had really bad weather, but I know up here anyway, it's been really windy and we've had some rain and it's not been the greatest. And I look outside and I'm thinking, boy, Friday, it's one of the nicer days. And I wondered if some people, even if they are teleworking, that they may be taking a little break to maybe do some yard work or something.
Oh, yeah. So, sorry, I was just realizing my phone's about to die, so I have to plug it in.
I know. I've talked with Allison, and she keeps saying, "Yeah, I keep wanting to call in, but then it seems like there's always something, that's happening on Friday, trying to finish something up or whatever, and she seems to keep forgetting about it." I should have gone ahead and called her and reminded her, that it was almost time.
Well, I know. I sent the email out late today, so I don't know. Kelly, did you get the email? Is that why I get the pleasure of your face today?
Yeah, well, I was doing bookkeeping, so I had to run and get presentable before I could get on the call. I will offer this. I have a lot of clients, and when it came to this mask program, they kind of ditched all their safety people, and it appears more like management has been taking care of this. And, let's get these masks, let's get them out there. Now you have OSHA with this whole letter saying, well, we're not going to enforce the N95 mask requirement right now. And I think that really impacts like the oil and gas industry when you start looking at silica sand. And so what happened there? Did we lose safety there? Because that's A, the mask not being available, B, they're not doing enforcement on it. And then you have no risk assessments being done on these different types of masks. I made masks in the beginning, and I made one that was very effective to the point you could not breathe. So 3 layers of material and a HEPA filter. What more could you ask for?
Perfect.
So you look at all the underlying health conditions that aren't potentially getting looked at. So they're not doing the respirator questionnaire. So we don't know if they have compromised cardiac systems, respiratory systems. You even look at folks with diabetes who have a reduction of circulation to their feet, let's say. Now you have this reduction in oxygen. So the end result, you still have the general OSHA says you're going to keep your employees safe. The outfall of this could be extraordinary if folks start having heart attacks or health conditions associated with these masks, or even on the other end of it, that it isn't good enough. They're actually still getting exposed because they're wearing a handkerchief tied around their face, and it's not even meant for lack of exposure. It's supposed to protect the person that's across from you.
Right.
So this is a reversal in PPE that we don't normally see. You're usually trying to protect yourself, not somebody else. So I think there's a potential for a real outfall on this.
I think so too. And I think, and what Dave and I were kind of chatting about earlier is that, I'm seeing people, okay, you're wearing a surgical mask, but here's my one that I have an image that I just haven't shared yet because it's so funny, but you see people that are wearing it under here and they're on their chins and they're on their head and they're fussing with it and then they're going and touching stuff. And like people don't understand the whole spread of germ things. And for me, okay, so we're worried about the big droplets, right? When you cough and you sneeze and all those sorts of things. Well, that's what's soaking up into all of this, and then you're touching it and you're touching other people. So it just becomes, and that's where one of the studies I was reading is that's where they were showing more harm in the contamination, because it's soaking into whatever you're wearing, then you're touching it, then you're bringing it everywhere. And then people who wear the gloves all the time and are just bringing it all over.
Yeah.
And that you're.
So just so you know, I'm actually going through antibody testing right now. Doctor's 99.97% sure I had COVID in February before they were doing the testing. I work from home anyway, so I had left several days before I got sick, went to the grocery store, came home, and had not left the house. So I know where I got it, and I know that on 4 or 5 days later, I went to the doctor, got tested for the flu and strep, both negative, and they gave me a flu shot. They gave me
After the fact.
a Z-Pack.
After the fact, they gave you a flu shot?
Well, no, because I tested negative. So I said,
Oh.
since I'm negative, can I go ahead and get the flu shot? And they said, yeah, and gave me a Z-Pack and sent me home while I started getting better.
Right.
But it was ridiculous what I went through. And so you have all of this that happened before.
Keep
You
talking.
have a peak, the risk assessment, the risk analysis on this is just, you got a lot of doctors looking at this, and I'm not sure I agree with all of their math on peaks and plateaus and.
Well, and I know it's a controversial video, but the interesting thing that I found, if you've seen the Bakersfield doctors video of how they have urgent care centers and they're doing their own kind of data, and it's not what I found interesting is it's not in the educational setting. So they're actually using real data and then going off of that. That sometimes that's where I don't, numbers, then it's another can of worms, essentially, for me in my brain, because I think, in my humble opinion, more people have it than we even know. I too think I got it earlier. I came back from Cancun in January with a horrendous cough and all that sort of, like, didn't want to get out of bed sort of thing. So I kind of think I had it earlier. I talked to many people who think they might have had it earlier. So if you kind of go with that theory of more people have it than you think, then that ends up reducing the fatality rate. And it's not as scary and, stuff like that, to where we could argue numbers. And I know lots of people love to argue numbers all the time. Me, as a health, wellness, and the physiology of it, the less stressed you are, the better your health, right? You eat better, you sleep well, but if you're losing money because your business isn't going as well as it was, if you're stressed because you're an essential worker and you have to work and all this stuff, there's so many factors that are going into your health and your immune system. That's my biggest soapbox, is that I'll jump in on from that.
Well, and you have everybody that actually voluntarily went into quarantine when originally asked. So they've been there way longer. And so when it got down to where all these people wouldn't go into quarantine, and you got these people going, hey, I did it, let me out. So there's a lot of energy there, a lot of stressful energy for people. It's been pent up.
I went to a conference in February, right at the sort of very beginning of everything here, and this was in Missouri, and so it was just loaded with college students from all sorts of surrounding states, and of course I stressed myself in driving there and coming back and not much sleep. But when I got back, I just started to feel terrible in a very short time, and I was out of work for, God, it seemed like it was close to 2 weeks. But I went in, I was a little bit worried about the COVID thing because it started to escalate. So I went into urgent care, and they said, well, you know, you don't have a fever, and I don't know, there was something else. And so they said, so, you know, we're pretty sure you don't have it. And of course, then they didn't have that much testing supplies. So they didn't test me. They just sent me home and, you know, said to rest or whatever. And now I'm starting to wonder, after I hear all of the information that's out there about the fact that, you know, everybody's different in their symptoms. And of course, there was that study of that ship that was like an adventure tour or something up, I think, to the Arctic. And they, you know, it broke out on the ship, but they found out that a huge, huge percentage of people had it, but they were asymptomatic. And so I really am waiting. I would like to be tested when they come up with something good to find out what I did have it previously. And, you know, I don't know, but
It'll be interesting. I think time heals all things. Kelly Long, I see you jumping in on your phone on your video there. Do you have some knowledge that you wanted to pop in and share?
Well, I was listening to all the talk about the fit testing and everything, and the refinery here where I work, we do not allow dust masks or anything like that. And now all of a sudden, everybody, I came to work one day and I have a K95, is it KN?
The N95, yeah.
Mask on. Yes. Yeah. But we've got another one too. We now have flame resistant masks.
I was curious about you guys. Yeah, I was wondering if you guys, what you guys do at the refinery, because, but they're still, so they're FR, but what's the level of protection? Kelly Campbell, do you know about FR masks at all? Have you heard that since you're?
Oh, it is woven. I can see through it, so I'm not sure how good it is.
Oh, you're on mute, Kelly. There you go.
Okay, that kind of brings back to what I was talking about earlier. The effectiveness of either direction on these masks has not been tested or evaluated. The FR mask, I actually have a client that is making them down in El Paso, Texas. I'm not sure where they got those from, but they're using the thinner FR material. So, like he's saying, you can see through them. If you can see through them, that's a pretty big hole. So, I don't know how much good. I mean, considering on how you sneeze, I suppose that could be a benefit. But
Right.
I'm curious, did they issue you just the one, or do you have multiple ones so that you can, you know, wash them and interchange them, or, you know, what do they do?
I'm sure I can get more, but right now I just have that one. I got it. I just happened to be in the office the week that they came out and questioned him on it, so they brought one over and handed it to me. I've yet to actually use it.
The Department of the Interior, they went in and, I don't know, they acquired a whole bunch of them, and they were going to go ahead and distribute to, well, anyway, within Bureau of Reclamation, I work for, they were going to go ahead and distribute 2 to every employee, but then I guess they couldn't get enough, so they gave 1 to every employee.
Yeah.
Because, I mean, the virus, the only reason the cloth masks are effective is because the virus is carried on a water droplet that can hit the cloth mask, but the virus itself is, is small enough to go ahead and go through that material. And so unless you're washing them or cleaning them regularly,
Well, they do say they do.
Like Lori was talking about.
Yeah, I mean, I think they do. They have clearly stated now that it doesn't protect you, the wearer. It's all about someone else. But it was in my head about the refinery because I'm like, okay, you can't do anything paper. I mean, high fire hazard on anything. So there's that. And I think Kelly Long, you've been on long enough to hear the discussion about well, how it kind of blocks your peripheral vision. So if, you know, the operators or the maintenance guys are going around the refinery and they're not, you know, able to see exactly where they're going or what they're stepping on all the time, you have to be more aware. You have to do those sorts of things. To me, that's where it's creating the bigger risk. And I see both sides. I said in my email, I don't envy the safety people that have to be the ones to drop it on your desk and say, well, someone's telling us that this is how you have to do it, and then try to educate on that information, how to wear it, what to do, and especially in your in industries where it's hot and you're outside and you're physically working. I think there's something that needs to be balanced there. And it seems like we've just gone too far down. I guess CDC or whoever, your state governments and whatnot, in my opinion, have gone too far down the rabbit hole that it's like too embarrassing to come back up.
Oh, yeah.
Which drives me crazy because we're talking about a different risk of people's health, wellness, and lives. So that's why I'm, you know, where do we go forward in a way that's not pinning anybody to a wall or, you know, respectfully giving them the information of, look, I have people that have a hard time breathing, that are stressed in their heart and health and whatever. That's another rabbit hole in itself. But
Oh, yeah. You know, these are for use if you go inside the refinery, the operating units of the refinery itself. But honestly, haven't seen that many out there.
yeah, well, that's good to know. And I know this is more for a longer conversation and one we don't have time for on Lunch with Lori because it's already 30 minutes. And it's my husband's birthday today. And I'm seeing a little text pops up that says, we're getting in the car. So I definitely want to keep this conversation open for any of you who, you know, want the links to where I'm reading stuff. I love reading and dissecting all the stuff that's out there and just kind of finding the holes, but then how you all can help me on where do you go forward that makes it effective in the workplace, that we're not creating more of a problem. So that was my main reason I wanted to get on today, and to show everybody that I made my own mask and my own smile because I had to teach with a mask on, and I hate that no one can see me smile. So I made my smile and I printed it on a stick, and you all can steal this if you want to. It's a paint stick, and just printed it a selfie on paper. So anyway, steal that. Oh, the rock tape on the nose. Yes, I think some of you know. Kelly might not know. Both Kellys here are in oil and gas, and so that's the other hazard that we just figured out. That, you know, rock tape is cotton and polyester, so it's not FR, and it sticks to your face. So then you have a whole, well, let me have a a flaming thing stuck to my face. Probably not it, but. Angie, I want to talk to you later about how yours worked more, but I can't because I'm getting texted that everybody's going to leave me. So I love you all. Thanks for joining me. Email me back if you got my email and let me know if you want to talk more about this or not, because I think it's a rabbit hole worth going down. Okay, y'all. So thank you.
Thanks, Lauren.
Thank you. Bye. Good to see you all.